Okay, so what I just wanted to cover today in talking about the Healthier Oils Initiative is why we're focusing on the small to medium-sized food outlets, what the Healthier Oils Initiative is about, how it works, who is currently working with food outlets, and what are the next steps. So why are we in this space? Obviously, for population health reasons, we know cardiovascular disease is one of the leading causes of death in Australia and in New South Wales. We know that having high blood pressure is one of the risk factors for cardiovascular disease, and our Australian Health Survey tells us that 33% of Australians have high blood pressure. And we know that, high cholesterol levels. I've been talking salt all day yesterday, high cholesterol levels. And we know that saturated fat intake is responsible for increasing our blood cholesterol levels. And while we don't have our National New Health Survey data yet, we know from the Victorian Health Monitor in 2012 that Victorians were consuming 13% of their energy as saturated fat, and that's almost twice the amount that the Heart Foundation recommends of 7%. So you can see there's still a lot of work to be done in this area. So also, why are we in this space? You've heard Julianne explain that we're in this space because this is where people are eating, and if we look at this, you can see that the small to medium-sized outlets, that's your restaurants, your cafes, your clubs and pubs, your hotels, motels, and your fast food independent, are eating in 2007, 70% of eating out of home meals were eaten in this environment. So when we talked about working with the TIC, we were really working with those 30% of meals that were served in that area. So it left more than twice that many meals being served in the small to medium-sized food outlets. So this is why we looked at this sort of sector, the small to medium-sized outlets. We also had an objective as part of our strategic plan to improve the profile of food being served to Australians so they eat less saturated fat and trans fat. And remember, this was back in 2007, 2008, our strat plan. So we evolved the Healthier Oils Initiative, and this initiative has three components to it. One is working with the councils themselves. One is educating the food outlets, and I'll talk more about how that is done. And the third component is actually looking at the consumers. So again, I suppose it's that both the top-down and the bottom-up approach. For 2.5 years, during 2009 to 2011, we actually worked with 6 councils in New South Wales to develop a suite of tools that would help us work with those councils or help the councils, because as Julianne said, we'd done previous work with Tips on Chips and with Clubs with Heart. So we had some experience in this area about how we would approach it. And with the Tips on Chips program, we actually trialled working with environmental health officers. But a lot had happened from the late 1990s through to the late 2000s. Things had changed. The tools that we evolved were, for example, a process flow chart that explained the process that could happen in councils. There were tools such as sample motions to help councils pass a motion at meetings. There was the 3-step guide, which was the Heart Foundation's information on healthier oils for the food service sector. And there were surveys to help environmental health officers actually have a look at what their current outlets are using. So how is it working, or how would we like it to work? If we know that councils actually don't have a legal stance to support them or force outlets to change to healthier oils. In an ideal world, we'd like that to happen. But we know it's got to be a voluntary system of outlets to change, and that's why the education and the encouragement that they get is a very important component. So this is the tools are designed to help them do this. At the local council level, we've got sample motions, and we'd like the council to pass a motion that supports reducing saturated and trans fat in their local government area. We also would like them to include objectives within their procurement policies, particularly if they have childcare or aged care facilities, and also to include the thoughts of healthier oils within their development plans. And also at the council level to have a communication strategy or plan around letting people know about healthier oils so that consumers are aware. Again, working with environmental health officers, we would like them to use the tools within the kit, including the presentation slides, that's been a fairly recent addition to that, to educate the food outlet owners and staff at their food forums that they hold on a regular basis. We'd also like environmental health staff to actually record the type of oil that they're using. Now, they can do this using the surveys that we've got included, or they could use the include it as a question on their existing forms, and a number of councils have done that. We'd like also them to include recording it on their next visit, whether that's 6 or 12 months later. That way we're able to see if there's a change, and also there's the potential of being able to calculate how much saturated fat they've actually removed from their local government area using this education process. We'd also like them to applaud the food outlets if they're using healthier oils. Now, some councils are doing this with a sticker, other councils are doing it with a certificate that's dated, and the outlets can display that. Other councils are using a name and fame section on their website. So there's various methods that they can use. And if the outlets aren't using the healthier oils that we recommend, then using the tools within the kit, including the 3-step guide, to educate the outlets about what are the healthier options they should be choosing. The third component of the strategy is around consumers. Now, during the developmental phase, food outlets told us that they would change their oils to healthier oils if consumers asked for it. Of course they would. But not many consumers were asking. So then we asked consumers or customers, what do you think about healthier oils? And almost 100% of them said outlets should be using healthier oils. They should be looking after our health. But they didn't feel confident at all about talking to outlets about healthier oils because they didn't know the information. So during a lot of customer feedback and focus group testing, we developed a consumer advocacy card. And it's called, Is It Time for an Oil Change? The front appeals to the customer, the back, when they hand it in, is speaking to the chef or the owner of that food outlet. What we're aiming is that it is really a conversation piece. It opens up a point of communication that customer can use, or they can leave it when they pay the bill, or they can post it to them if they don't feel confident in talking to them. So who in New South Wales is using this? We know from our annual local government survey and our individual contacts with councils that there are 17 or 11% of New South Wales councils currently have a policy in place, or they've got practices in place where they're actually educating food outlets. And I've just put a list of those up there. What they're doing in each of those councils is different because each council is its own entity. And I'd like to talk to you about all the great things that they're doing, but unfortunately time doesn't permit. So just to pick out two, one, at Parramatta City Council, the social outcomes officer and the environmental health staff have been working with the local health district nutrition manager, and they've been, during 2013, surveying the councils food outlets within that council and getting some results. Now, to facilitate that, because we know environmental health officers are very, very busy, they've developed this tool which records the NIP information on that oil can or carton. And then it's provided to the local health district staff and they do the analysis. So they've been working together on this. I can't give you any results, but they look really good in draft form, and I'm sure they can't wait to disseminate those in the very near future. Cessnock City Council have been working for many years on looking at their healthier oils and educating their food outlets. They have a Healthier Oils working group that is made up of the environmental health staff from the council. It's made up of the Heart Foundation, the Samaritans, local health district staff, and several very, very interested, already converted food outlet owners. And so what we did in 2012, we disseminated the advocacy cards through them, and they developed a dissemination strategy through 2013. We went back in November last year to evaluate that dissemination on the Healthier Oil, on the advocacy cards, and it just happened to be the hottest week in Cessnock that you could imagine. So customers in the middle of Cessnock were quite scarce, but we managed over those few days to get, with the students, to get 100 people surveyed. And when we did the calculation, we found on the estimation of the population that we probably reached about 16% of the population, with approximately just under 5,000 advocacy cards disseminated in that period of time. So we felt that was a good outcome. What we found was that of the 100 people we managed to find in the heat, in the streets, only one had actually used the card. However, when we asked them about the healthier oils and food outlets, almost 100 again said that they felt they should be using it, and they said if they had a card, 59% said they would actually use it. Now, the intention to use, I know, isn't the same as actual use, but I think that's progress on, and it's our first time of assessing the use of that advocacy card. So, if we look at what's happening in the current environment, these are 2013 stats, we can see that there's been a change in the eating out of environment pattern of meals, but just under 50% are still eaten in that small to medium-sized food outlets. If we look at the oils that are consumed in this, you can see that they're quite a significantly increase than the oils used in the QSRs. So proportionally, there's more oils used in those small to medium-sized. So what are the next steps? What are the gaps? First thing is to reach those other 89% of local government councils within New South Wales. I think a unified and collaborative approach across New South Wales needs to be looked at and examined and discussed. Each local government we know is an entity unto itself, and how we unified that, I think, needs further discussion. And also in our working with these councils, there's many councils out there that have a need for educational tools in different languages. So there's a gap of this material there. I think opportunities would be that, as this strategy is listed on page 32 in the actions of the supportive environment section of the HEAL strategy, we should use this forum to further discuss and collaborate on how we can extend the Healthier Oils initiatives across New South Wales. I think we have an opportunity with the outdoor smoke-free environment coming in for legislation in July 2015. We have an opportunity to link the education material and working with food outlets on that. And I think there's an opportunity where we can or councils have the opportunity to communicate the successes that are occurring in their own council areas, and labelling or flagging the outlets that are using healthier oils. And if you want to know more about the Healthier Oils initiative, you have some resources in your bag, but you can log on to the Heart Foundation website /catering, and the resources are there. Thanks, Adam.